Welcome to the TEConnect podcast. It's time to get connected.
Hey everybody, welcome back to the TEConnect podcast, where we talk about the topics, trends, and of course technologies impacting the reseller channel. Today we're going to be talking with Dr. Christine Perales, as well as Matt Jordan. I'll just introduce them a little bit further in a moment, but our topic today is going to be the digital transformation in healthcare. I'm your host, John Martin.
And I'm Dean Reverman.
It's time for us to plug in and get connected.
Absolutely.
So as I said, I want to kick things off by introducing our guests. First up, we have Dr. Christine Perales with us today. Dr. Perales is a digital transformation expert. She has been on the front lines of initiatives around EHR, going paperless in healthcare, as well as healthcare infrastructure, basically anything involved with the digital transformation of healthcare, which makes her the perfect guest for us. Dr. Perales, welcome aboard.
Thank you, and thank you for having me.
Definitely. We also have with us Matt Jordan. Matt is the Healthcare Business Development Manager here at BlueStar on our Zebra team. Matt, thanks for joining us also.
You got it. Thank you, guys.
Let's get into our topic of conversation. We wanted to talk today about digital transformation in healthcare. Again, Dr. Perales is the perfect person to bring on board with this. Obviously, a very important topic right now in the current pandemic because we've had to change a lot of practices. Telemedicine is bigger than ever before.
Unbelievable.
And I don't see that ending anytime soon. And honestly, coming out the other side of things, I'm sure there will be some rapid changes and transformation. It's unfortunate that something like this has to happen to make change occur, but it's usually how it works. Necessity is the mother of invention. Mm-hmm. So, Dr. Perales, I want to start with you by talking a little bit about how do you feel digital transformation has accelerated? What has been changing currently, and maybe even over the last few years before this happened?
Well, in the last few years, I was with Microsoft. I was the national director for medical devices at Microsoft. And when we talk about healthcare, I think we need to talk about in the digital age of health and life science, because that includes the device manufacturers as well. They were being impacted by this smart age, the smart manufacturing, to get the product to the consumer sooner. Connecting with their consumers, and those consumers can be healthcare professionals, like patients and stakeholders. That was the scenario before the pandemic. When the pandemic hit, all of a sudden it was, we need to speed up our plan. We need to mobilize quickly. Those plans that we had for 5 years, we're going to have to speed them up because it's a new age. Things are going to have to be different. We have to protect our healthcare professionals. So that means less contact, but still more monitoring. Mm-hmm. We have to protect our patients that are not hospitalized, but how do we take care of them remotely? We have to be able to, we're seeing the supply chain. We have to be able to respond to the consumer need quickly. By leveraging robotics, by leveraging smart manufacturing, and leveraging analytics. So this whole idea of predictive and prescriptive analytics, as it ties all of this together, is something that has been sped up. They had plans to do it within these next few years, and some of them already started on their road to do that by starting to set up their infrastructure. But now with the pandemic, things have sped up very quickly. Another thing that's also impacting what's happening right now are the grants and waivers that have been put out by the federal government to support those entities. So there's the 1135 waiver, there's the FCC grant, and there's different grants for long-term care facilities. And, let's understand and qualify what long-term care facility includes. It not only includes nursing home and skilled nursing facilities and hospice, it also includes independent living and home health. So that's coming in there as well. And remote patient care, and monitoring, which are two things. Remote patient care is that you're getting information and you're taking care of your patients and managing your patients remotely. And remote monitoring is that you're monitoring a specific condition or monitoring specific vitals for that patient. remotely. So these are all things that come into play that have been sped up in this new paradigm shift, basically.
Yeah, and when you talk about, if we could dive into the remote aspect of it, you hear a lot about that. Telehealth, the use of wearables, the use of mobile technology. Really, to your point, Dr. Perales, I can just imagine the time compression that's happening right now. Whereas what might have been on a chalkboard or a whiteboard, 6 months ago, as well, this is what this might look like, compressing some of that just to face the needs right now of being able to address remote care, for example, or even remote monitoring. How does that, that has implications as I think about it across hardware, across software, across all aspects of it as well. Maybe there are even some regulation issues. So what are some of the key facts or findings that you're seeing on the mobile side right now as it relates to this digital transformation that's occurring?
Mobile is everything right now.
Yeah.
Everything is mobile. You know, this virtualizing of how we deliver our healthcare and life sciences as well, because that includes the medications and medication development and manufacturing and supply chain. That is one of the key components. And, this is going to really expedite 5G because we need to get to those remote areas which have difficulty connecting with healthcare. But as well, we see, you were talking right now about manufacturers. Well, manufacturers, they're going to have to change how they're doing things because they're going to have to bring in robotics. And even in healthcare facilities, we're seeing where they're even talking about bringing in robotics for securities to have like mobile security units to monitor the area. You have to understand the human factor as well. There have been reports where some family members, in desperation to see their family member find out, they've been trying to sneak into the wards. But then that's putting at risk the security team and putting at risk other people. So even security, something so simple as security, is impacted by mobility and being able to monitor things remotely. So that whole virtualizing and mobilizing and being able to deliver services on the fly, basically, that is going to be and is one of the key components right now. Like your phone will become also another device, a medical device that you're going to use. For example, the Samsung device by the Flash already has a heart rate monitor that you could click on. There's Bluetooth devices that Bluetooth to your phone, and it could be synchronous, that's real time delivering information, or asynchronous that collects it and then sends it later or downloads it later. So that mobility piece is important. And there are federal grants helping out there to help those areas that we think are going to be greatly impacted.
Yeah, I totally see how mobile is accelerating along the way. Matt, maybe some of your comments either on technology that's accelerating right now within the space, or hanging out on the mobile side there.
Yeah, exactly. And definitely to emphasize the mobility segment again, if it wasn't loud before, it's definitely gotten a lot louder and even an increasingly sharp, greater adoption, as Dr. Perales has said, and I think as we're seeing in the industry. So it's mobilization, it's creating greater efficiencies, it's how can I optimize the workflow immediately, whereas your digital strategy or your mobile strategy before was, we may look at this in 6 to 8 months, we know we need to do it, we may not have the funding now. Well, now is here, or now was here 2 and 3 months ago, and instantly you feel like you're behind. So you're seeing the greater adoption of telehealth immediately, not just out of a convenience, but almost a mandate that created
necessity.
In and of itself.
Yeah.
yeah, you physically can't enter certain healthcare entities and facilities. Okay, so what's the workaround? The technology was there with telehealth. Certain health systems now need to get it up and running if they didn't before. And as the grants were mentioned, funding has been provided and delivered for that. So the ability to now get past the I don't have the budget for it is essentially waived, and you can move forward, and restrictions have been lifted, et cetera. So you're seeing, of course, just to further expound on this, as we've heard, drive-through testing, remote testing sites that are managed by the private sector or by individual state health associations to include different mobility segments of mobile computers, laptops, carts, printers, to simply set up a triage situation, if you will, a temporary hospital, an overflow. And so whatever was needed inside the acute setting within four walls is now instantly needed over here, over there, and we need to set it up now. So you're seeing some of the same mobility situations just extend.
In a tent in a parking lot, I mean, literally, those types of things. Yeah,
Definitely.
Yeah, and something that has been available and it has been used globally for that mobility to mobilize online workers very quickly has been containers. And for the VARs, that's a very interesting proposition, because outfitting that container to become a ward, an isolation ward, become an emergency unit, become a lab, is something that's very interesting, and something that can be mobilized very quickly and become a mobile unit that could go around. So that's a thought also, creating those mobile testing centers, because we know we need to test. We know we have a target that looks unbelievable to achieve. But it's an opportunity to look at and say, what will it take? Well, we need to mobilize, and we need to mobilize quickly, and this might be a way of that.
Yeah, it seems to me very intuitive because it's the efficient use of resources. And what I'm hearing, I think what we're all hearing is that as this pandemic progresses, one of the things that we're going to need to have is mobility in that space, if you will. And I guess we can tie this in a little bit to the analytics, which Dr. Perales, maybe we could dive into here, because obviously the healthcare community has been using analytics prior to this. Now this is probably one of those items that's being accelerated. Again, just to connect it back to the mobile testing, as hotspots appear, and as analytics are used to see where those hotspots might be, we're going to have to allocate resources appropriately, not just at a federal level, but at a state level, and then even within a county or something like that. So what are some other ways, you mentioned analytics, what are some other ways that analytics are being used or accelerated in this new normal, if you will?
Well, analytics were starting to be used, like AI and machine learning, and being predictive in sepsis, for example, predicting what patients in the wards can have sepsis. There's even now a grant available to look and say, okay, let's get out of the facility and let's start predicting sepsis before, maybe days before they even come to the hospital, to prevent it coming to the hospital. Those predictive analytics are something that are being looked upon to say, how can we use these same predictive analytics to look at outside of the hospital, a few days out, a week out, to be able to analyze this and mobilize. And that's what the prescriptive part comes in. It's no longer just predictive analytics. We have to tie in those predictive analytics to prescriptive analytics and make that a green tree cycle where it keeps on feeding it. And like you mentioned, there's a hot spot. Okay, so what do? How do we mobilize? How do we mobilize quickly? So what are those things to mobilize quickly to those areas? And continually monitor those areas and see and learn as we there what caused those hot spots. One example, which is pretty cool, is they took one of the beaches of the spring breakers and they tracked them, how they went across the United States. It's going to have to be something like that. Governor Cuomo mentioned that with the analytics that he has, if he sees that something happens in the community, he knows those numbers are going to go up in a week. He already knows by the analytics. He can see and track it on the analytics, and that's how powerful those analytics are. The thing is being able to learn from them and mobilize and be prescriptive to the action.
Yeah, definitely. Yeah, I was doing some research on healthcare analytics recently for a marketing project, ironically enough. And one of the interesting facts I found was that I think around 31% of hospitals and healthcare facilities have used analytics, but only used them for maybe about a year. So I feel like there's probably a big gap there where people are like, okay, we'll try this analytics thing out, and then don't figure out the proper way to utilize it or to do something with it, and don't quite understand what they're looking at, and end up abandoning it after a while. When in reality, they should be continuing on because, let's be honest, analytics, need much more time and input in order to actually be effective. Is that kind of what you're hearing too, Dr. Perales? Like, do you feel like people have been kind of stepping away from analytics sometimes when they shouldn't have and should have kept with it for longer?
Well, in my experience, while I was at Microsoft, what we saw was they needed to create a data science team. They needed to have the right infrastructure to collect the data. And where are they going to put that data? So it's a matter of infrastructure. So if we're going to look at digital transformation and mobility, the first thing we need to look at is the infrastructure. And what can we leverage and where do we need to enhance that and secure that infrastructure? That's the biggest fear with the analytics, is because of the data that you have to pull and the data that you have to work with. So they're a little bit, apprehensive of having all that data and getting that data, and what if it gets hacked, or what happens in transit, so that's one of the apprehensions. So how do we overcome that? We overcome that with implementing good cybersecurity protocols, high tech, having solutions, being able to communicate the security behind the solutions that we're using or promoting, to give that level of security to move forward. Those institutions that they use the analytics greatly. One example of that is Rush University Medical Center. They rely heavily on their analytics. So they're using it, and they're one of the examples of the benefits of already having a telehealth program and having analytics involved with that. So it's the key here is the infrastructure. So they're able to gather all that data. For the analytics to be useful, you have to get all sorts of data. It's not just clinical data, it's claims data, it's even weather, it's even traffic. How that impacts whatever you're looking to do, because that will be something that will be used, later on. I think one of the biggest things is we're going to be now looking at data related to employment. What line of work are you in? What are you doing? Because then we're going to have to evaluate how much contact that person is having and what are their risk factors, because they have that contact. Because you can be negative today, walk out from getting your test results, come in contact with somebody and get infected. So because you tested negative today doesn't mean 2 months down the line you won't be positive. So that's a high risk. So managing all that data is where the analytics come in. And then the prescriptive ones come in the background of what are the best results? What is the best course of action? What has really worked and what hasn't worked? Because we don't have time to play around. We don't have time to go and see how it works and doesn't work.
So true on that point there. I mean, I think we all feel, and certainly those in the healthcare, from the pharmaceutical companies across the board, feel the pressure. Unlike anything I can ever remember in the healthcare space, if you will, the pressure to be able to react, to be able to get information very quickly, to be able to determine, the results and make determinations very quickly thereafter. It's unprecedented in so many ways.
Yeah, I agree. Yeah. Matt, let me ask you real quick to wrap this particular segment up. What are you hearing? You're out there in front of our resellers, you're out there in front of our vendor partners, software companies. What are some of the innovations in healthcare that are kind of sticking with you right now and the questions you're being asked most frequently?
Yeah, I think it's at least from my perspective and some of the partners that BlueStar has been working with, just our fantastic ecosystem of different software vendors, reseller partners, vendors. Something is being brought literally to the table. It seems almost like every week, a new flavor, a new solution, or somebody that's repurposed some existing equipment into and something else. And just to get into detail a little bit, one it was the remote testing, the drive-through. That wasn't something in play before, and all of a sudden for 1 week it became a very hot topic, and folks have been clamoring to put some of the solutions together with some of the hardware and software pieces. Next week after that, it may be something else, and then it seems the hottest flavor and is becoming some of the fever monitoring or temperature monitoring that we're seeing, maybe even in a kiosk application. There might even be some facial recognition involved as well. It might just be an individual screening, it's more of an access control solution if you think about it. And then or a mass fever screening system that a number of vendors have brought to, at least to my attention and to BlueStar's attention, in a little bit different form factors, but at the end of the day, they're really providing the same thing. Either you get in the building or the facility, or you don't, based on your temperature. And the interesting thing about that is, of course, that's addressing a current COVID need in a current situation. But the phrase "the new normal" that we keep hearing thrown around, I think that's going to stay. That will be the existing normal. I think from a future standpoint, that'll be a great solution that folks can go after. Because I think that's something like that's definitely not going to go away.
Hard agree.
So true.
Yeah. So this has been a great conversation. Honestly, I think we could keep on with this for quite some time, but we do need to jump over to our recurring segments. I do want to let any of our listeners, though, know that if you are interested in giving us a little bit of feedback on this topic, if you've heard some interesting things, have some questions about digital transformation in healthcare, don't hesitate to connect with us. You can find us on Twitter at TEConnectPod. You can also email us, TEConnect@bluestarinc.com. So I want to transition over to our final couple segments here. One is value to the VARs. This is where we take everything we've discussed already today and figure out what does this mean to our reseller partners? What should they be doing? What action items are important for them? And the question that kind of popped up to me when I was thinking about this segment is, this is obviously a very difficult time to be working with anybody in healthcare because they've got a lot on their minds. They've got a lot that's happening. And, I think a lot of our resellers are probably being very reactive to situations when someone's coming to them and saying, hey, we got drive-through testing. We need to get all these mobile devices and figure out how we're going to, work this out. But, and Dr. Perales, this is probably a good question for you because you deal with a lot of these people, but how, should our resellers be approaching decision makers right now in healthcare? Should they, if they heard some of this stuff maybe and think, we've got a solution for that, I know we could help out with that. No one's really asking us, but we've got something we could help out with. How should they be talking to these people?
I think the success is, in order to capture their attention, you need to capture what the problem is. So I'm going to give you an example. PPEs, right? Well, a solution that does perpetual stocking is something that they would listen. So we don't have to have, recheck and count and then be told at the last minute that we don't have. Being able to do those solution. Like Matt said, fever. There even came up with one they put on the door, and when the employee gets to the door, it does facial recognition and temperature control, and it opens the door or not. You either come in or you don't come into the facility. Looking at those things that are their pain points are very important. Being able to talk to them and ask them, what is your pain point? I'm not going to come to sell you now. Tell me what are your biggest problems right now, and I'll come back to you with a solution. That is how you're going to get them to hear. This is the time to go out because this is the time where they're living the pain. In healthcare and healthcare administration, the biggest problem that we have is we don't mobilize quickly unless we're feeling the pain. And this is the time that they're feeling the pain and they move quickly. And there's funding available. There's local funding, there's federal funding, there's philanthropic funding, and there's different funding. This is an opportunity to go out and talk to them and help them. And this is the time to innovate. If you have a solution that really isn't related to this, but you see that the backbones of it can be transformed rather easily to address an issue, use it. I mean, if you look across healthcare, a lot of the innovative solutions come from another industry. It might be another industry that you're working with, but it's a solution that might, or a device that might help in this scenario. That is something that I highly recommend, and going out to see these healthcare facilities and decision makers is leverage that and learn the grants, learn the funding that's available, because you can tap into that. I've joined alliances with health IT resources to help on this digital journey, help people out there. And one of the members writes grants, and I said to him, this is really good, because a lot of people are not applying to the grants because they say, I don't have a grant writer and I don't have time to sit down and write a grant. Right? So look into that, see what grants are available, and if they come back with that, say, don't worry about it, we got somebody, right? You can apply it, you can get this.
Yeah,
that's awesome.
So this time is the time to learn for yourself, but this is a key time to go out there and be, it's sad to say, make those sales, but those sales are necessary to help the industry.
absolutely.
That is excellent advice. Matt, what about you? Any tips that you would have for resellers?
Yeah, I would echo a number of points from what Dr. Perales had mentioned, but it's really with the messaging of we're here to help. That was emphasized on the front end of that was don't always be selling, but try to be proposing something that's related to the solution at hand or some of the problem at hand. And I think that's where VARs are still have the capability to do that, because we are an essential business right now, thankfully, at the BlueStar level and also at the reseller level. And healthcare definitely has a number of concerns and needs that have to be met very quickly. So I think folks can play in a lot of different areas, and we're having a number of different VARs who may be just only play in the lab segment, on the ideal specimen collection. Okay, well, you know what? There's a ton of opportunity in a lot of the other floors of an acute setting, or have you thought about other areas, maybe even supply chain? What about some RFID applications? It's really just about asking the questions, because there's definitely some needs out there, a little bit, some maybe more critical than others. And there's definitely enough wealth of opportunity to go around to meet those needs right now. And then of course, you're going to become a very good trusted advisor at the moment. And then of course, a lot of that equipment can be repurposed, or at least there's a good idea of a future proofing that it's not just meeting the need right now, but from a strategy moving forward, it's going to be a very good investment.
Yeah, and you touched on a point, Matt. We're talking about RFID and facial recognition and temperature and security. They're even using that. They're taking a crowd control solution. Some of these entities that have money, they're using crowd control solutions to monitor the people in the hallways and to monitor their temperature. If their body temperature goes up, they go get them. It's a little bit big brother, but it's needed right now.
Yeah, definitely.
So looking at those solutions and saying, we can help you. What are your biggest issues? That is going to be a very welcome conversation.
And John, I'm as I kind of reflect on the conversation here, and maybe some of the value to the VAR that I see is kind of going back all the way to the beginning of the conversation when Dr. Perales kind of tapped into what I call, and I'm going to be paraphrasing you here, I apologize, but it was the sense of camaraderie, an unprecedented sense of camaraderie amongst technology companies, educational institutions, healthcare institutions, banks. I mean, everybody. It's nothing like a cause to really rally everybody together. And I think that as a business, you can, not just adapt to that, but embrace the fact that there's a certain amount of camaraderie in our society in general. So before you go in to talk to those decision makers, I think there's been some excellent advice here. Leverage some of the camaraderie out there. Don't be afraid to go out and focus in on a solution, on a particular problem that there might be. Find out who throughout the ecosystem, tap into the vendors that we have, or the software companies that BlueStar or companies like Zebra can help you tap into, so that you can have those conversations, leverage the camaraderie that's out there. Because everybody, if you just mention, hey, we're doing this because it's an effort to address the pandemic, you're going to get a lot of people that may not have been bedmates, if you will, before.
Right.
Okay, let's start marching down this path together. And I think that's something to look for in a time like this. Only can benefit all of us there.
No, I agree.
We're seeing a lot.
Yeah.
Yeah. When we talked about digital marketing last week, I think I kind of said that it's okay to be irrelevant but supportive right now. So I think it's very important, like you said, to get out there, bring up that camaraderie, talk about, hey, I'm just checking in with you guys. I want to make sure everything's okay. Is there anything you need? I'm happy to help. We're operational, ready to go. If so, if not, that's fine. We'll be here when you do need us on the other end of this. So maybe you do have something that can help right now, but maybe not, and that's okay too. If they know that you're there, that you care about them, that you're paying attention to them, not just because they can, cut a PO over to you, but because you actually do care about them and their livelihood and their business.
Yeah,
So
sure.
great answers all around. All right, so let's talk about our last segment. I'm sorry, Dr. Perales, do you have something to add?
No, I was just saying that in that conversation, you might get the response, well, such and such vendor, I'm getting problems getting this, and that vendor, and you have something that can help that vendor, indirectly, you can support that customer by working with that vendor that's giving them a problem. So don't discard being able to go out to another vendor and say, hey, I know you're having difficulty supplying this particular customer. I can help you.
Right.
Excellent point.
Good point.
Excellent point.
So for our final segment, we are going to ask the question, what's tech connecting with you? In this particular segment, we basically all talk about maybe something technological that is exciting us, that is interesting us. Could be as simple as a fun app, a great game we're playing, a good podcast we're listening to, just what's catching our attention right now. It can be something big, something small. It doesn't even have to have anything to do with what we've talked about today. Matt, I will let you start. What's tech connecting with you right now?
I think some of the interesting things with more so RFID, RTLS, locationing systems, wayfinding. It's kind of a bunch of words just out there, but really, where's my stuff and what condition is it in, or where are my residents, where's my patients, and things like that. That a lot of this stuff has been around, of course, for a number of years. But I think just seeing the adoption and seeing the different pieces of the technology. At least some of the areas that I've been working with, some of the medical supply chain, it can be complex as you want, it can be simplistic as you want, but just you're seeing a lot more of the not just so much of a rudimentary way to go about it, but then pulling in AI and analytics into that as well, and so just seeing the mesh of both of those two scenarios. It may be two different lanes of technology, but then meshing together in some sense where it's playing well, at least from what I'm seeing, and just some of the partnerships and relationships we've seen out there from a medical standpoint.
Definitely. Dr. Perales, what about you? What's tech connecting with you right now?
Well, I'm going to echo Matt, and I'm going to add what I think, and I'm always very interested in, is the augmented intelligence, where you're bringing in the mixed realities with the analytics and the bots, tying it into what Matt was saying, the RFID, all the tracking and maintenance systems that we can use, but be in a hands-free environment and be able to leverage information with voice commands as well. That's something that's interesting to me, because I see that in this situation now, we're going to see a spike in that. And I love what World Economic Forum is doing to bring information from around the globe into one platform where you can go and look and see what everybody is doing to learn and say, hey, that's pretty cool. If I take this and I take that, I can really do this. So those are the two things that are really exciting me right now. But really the mixed realities tied in with bots and tied in with AI and ML is something that I'm very tech connected to, as well as robotic. For the manufacturing end of it, I'm really connected in robotic process automation.
Awesome. And that's cool. Robotics are something that's really fascinating to watch. Oh my gosh, if I see another video of something, is it Boston Innovation or something like that? There's a company out there that's really into robotics as well. It's just fascinating what they can do with robots today, and we've just touched on it barely. Maybe we should do a whole other podcast.
We probably could.
On robotics,
Yep.
Not just in healthcare, but robotics in general. One thing that I had written down, and actually Matt and Dr. Perales have already kind of touched on it a little bit. But here's the phrase, because I was reading an article on AI, and here's the phrase that kind of made me pause a little bit. This article is in Scientific American. And the sentence is, it's time to put artificial intelligence on a data diet. And the whole comment here is it's that constant juxtapose between the power of what AI can do in so many environments as it relates to our personal rights. And here the argument was, we need to put AI on a diet when it comes to things around our personal lives. And it's fascinating to see how a technology that is, when you have people like Stephen Hawking and Elon Musk warning, of what AI can do, and you see how it's being used in China and things of that nature to really limit a society, or depending on how you look at it, it's fascinating. Yeah. So that one phrase there, artificial intelligence on a data diet, I don't know. There might be something to that.
There might be.
I don't know, John. What's TEConnecting with you?
So as always, I'm going to get a little more down to earth and pop culture oriented, because that's the stuff
we're good with pop culture.
Yeah, that's the stuff I play around in. So I've got a podcast recommendation. It's called Staying In with Emily and Kumail. So Emily Gordon is...
Now, wait a minute. Was this also available pre-COVID?
It was not, actually.
Okay,
so this is something that's come about because of the pandemic. And I don't
right.
know if it's going to last post. It should. It's great. But this is Emily Gordon, who is a writer and producer in Hollywood, and her husband, Kumail Nanjiani, who's a comedian and actor. He's been in Silicon Valley. He's done little guest appearances on a lot of different things. They're a married couple, and they basically decided to start a podcast about their life staying in. These two also are kind of known for a movie called The Big Sick, which was all about Emily's autoimmune response issues, which actually led to her falling into a coma shortly after they started dating. So the movie's kind of an interesting little quirky comedy about how, they got together and how he had to deal with that of dating someone new when she's in a coma and he gets to meet her family for the first time under those circumstances. Yeah. It doesn't sound like it should be funny, but it is. So they've decided to do a podcast together. It is absolutely adorable and hilarious. They're clearly a couple that enjoys their time together. They basically sit down for anywhere from an hour to an hour and a half every week and just talk about what they're doing, what they're watching, what's making them feel things this week. There's a segment they have, like, what made me cry this week, and sometimes it's as silly as a commercial and as epic as, just the state of the world, kind of thing. Right. Yeah. But there's such a charming and affable kind of relationship between the two of them that you can tell that they just enjoy sitting down and talking to each other, regardless of whether it's a podcast or not. So hopefully it lasts for a while, but right now it's one of those things that every week I enjoy hearing a new episode. So Staying In with Emily and Kumail.
There you go. That and John Krasinski's Some Good News.
Yes.
Those are two things that have to keep continuing.
Yep. I agree.
Post-pandemic.
It doesn't, just because the pandemic ends doesn't mean we don't still need that kind of content in our lives.
That's exactly right.
All right. Well, again, we've had a great conversation. We could keep going for hours, but it is time for us to unplug. I want to say a special thanks to Dr. Christine Perales and to Matt Jordan for your time today. We very much appreciate the conversation.
Yes. Thank you very much.
So until next time, Dean and for Dean Reverman, I'm John Martin. We are going to sign off. But until then, everybody, please stay connected. The TEConnect podcast is brought to you by ELO. Healthcare technology demands quick response, durable, and reliable solutions. That's why Elo's O3 series of medical-grade touchscreen monitors were designed for healthcare professionals and the environments where they work.
With a compact form factor and clean design for easy integration, these monitors meet IP54 rating requirements and include a special power supply that is IEC 60601 compliant. Combined with Elo's industry-leading PCAP anti-glare touchscreen technology for a monitor built to last and backed by a 3-year warranty.
Flexible installation allows the O3 series monitors to be used for nurse stations, exam rooms, clinics, pharmacies, or for patient check-ins and directories. Choose displays from 19 to 27 inches and add accessories like privacy screens, handles, or mounts to customize for any situation. Contact your BlueStar representative to learn more or visit BlueStarInc.com. The TEConnect podcast is brought to you by Honeywell. No time in recent memory has been more stressful for healthcare worldwide than right now.
Honeywell productivity products have been working closely with healthcare customers during this time to ensure that they have the resources they need to address the frontline issues in real time. Honeywell provides hardware, software, and connected solutions that streamline workflows and improve clinician well-being so they can focus on what's important, patient care. Honeywell delivers on this promise through industry-leading mobile computers, data capture devices, cloud-based software, and automation solutions.
Contact your BlueStar representative to evaluate your customer's unique needs and see why the Honeywell healthcare solutions for hospital workflows like patient care and identification, clinician productivity, patient safety and security, and asset management are the right choice for meeting current and long-term needs. The TEConnect podcast is brought to you by Zebra. Analytics are providing valuable insight to healthcare providers, from identifying disease spread to spotting operational inefficiencies and even predicting appointment cancellations. That kind of analysis requires a lot of data, but where should this data come from?
To assist with that question, Zebra has sponsored an ebook called How to Leverage Real-Time Data to Improve Patient Care. It outlines how to position your product assortment as a way to collect quality, actionable data from inventory, patient management, supply chain, and more.
To get your free copy, visit vartechnation.com and search for Patient at the top of the page. While you're there, check out the rest of our free ebook library.